Site. Can you please point out with the finger where exactly it is? Can you please tell me where else it is and how long you're having this? And can you tell me the size, exactly what size over it? And over the time, do you notice any change in size? So can you tell me the shape of it? Have you noticed any change in shape? Can you tell me color of it? Have you noticed any change in color? Do you then symptoms? Have you noticed any bleed at all? By any chance, when you touch it, you feel it is bleeding. Have you noticed any discharge out of it? Any itchiness or tingling sensation on it? Any pain? Anywhere else? Size, shape, symptoms, sun exposure, color, trauma, insect bite. These are the things. And apart from that, in most of the history taking, I would advise you to ask about flaws in the histories. Remember this mnemonic: flaws, STI. If the patient is young, you can ask other STI or this one as well. So always consider asking these flaws and STI. Okay, good. So now you see here fever, lumps and bumps, change in appetite, maftosa, signpost thinking about your general health. Then you will talk about medicine, which medicine you're using, or do you have any skin problem previously? Do you use any what we call it, what sunblock? Then you will talk about DASA, lifestyle. By any chance, any family history of cancer? You do need to ask always family history of cancer, and diet, exercise, smoking is very important here. You need to ask work, home, driving, hobbies, ID, expectation, concern. Have you given a thought what it could be? And reflect back on that. Examination and investigation will take your observations, will have a look of your skin through the dermatoscope as well, because a lot of GP do have dermatoscope and will feel for lumps and bumps. Might need standard blood to rule out an infection. Explain finding of lesion, rash correlate with diagnosis. Explain in simple words. Double check understanding if suspecting cancer. Mention you are suspecting more than infection, and be sinister like cancer if you are suspecting cancer. Patient-centered approach. Mention referral, that if you need to do a 2-week referral, management options, medical or conservative. Explain step of management, reading material, safety netting, reflect. You will need to do that. And if you need to do, if patient get unwell, other skin changes, and then 2-week pathway if they have anything like that. So this is how you will do. I want to show you a few scenarios now quickly so that you see the scenarios. You have an idea now, because don't worry, I want you to see the scenarios, how it present, and after that you'll see in the simulation-based teaching. Then tomorrow again, I will ask you to attempt with me. Okay, so let's start with 65-year-old woman has presented with skin lesion. So you have got a lesion on your back and the head, face, hairline. I have not seen it yourself because it's on your head. Your wife is one, saw it about 6 months ago. So it's a long history. And you had a similar lesion 3 years ago, and the GP froze it. You need to work in Australia under the sun exposure history. When you will ask about the sun exposure, you'll get that information on a ship, but you are now retired. Back of the head, cryotherapy was done 3 years ago and not affecting his life routine. On face, painful, affecting his life. So you will do the cancer urgent 2-week pathway. Hairline effects due to location refer cancer 2-week pathway urgent. So this could be lesions like this. So it is a basal cell carcinoma. You can see here it might look like this, and it is a basal cell carcinoma. Okay, now a 62-year-old man who has presented with the lump. The wife asked him to go and see. If I just want you to observe this scenario, and when we will be doing the simulations, when I'll be drawing a sketch for you, you will understand the differences in all of those scenarios. The wife asked him to go and see the doctor. That wife noticed on the head, it has been there for 1 month. It's a bit reddish than my normal skin. This is no bleeding, but there's a little yellowish discharge. You are retired now. You used to work in China for 3 years, in Australia for 3 years. You used to work outdoors. Squamous cell carcinoma refer via 2-week cancer pathway. That is a squamous cell carcinoma. And the squamous carcinoma you can see is on the air. It's like ulcerated. I'll talk more in detail about that. So let me give you a few things that will help you to remember. And those scenario basically Okay, so basically the basal cell carcinoma will be mostly head lesion for maybe 6 months. So this is on the head or on the face. It could be on the head. Basal cell carcinoma would be on the head and usually above neck. So if you are thinking basal cell carcinoma, it would be above neck. It would be on the head. Above neck would be on the head. And squamous cell carcinoma, and again, it could be lesion on the head, usually below the neck, or sometime it could be on the ears. So remember that that is squamous cell carcinoma. Okay, so 60-year-old, another scenario you will see 60-year-old lady presented with a skin lesion would have a melanoma. And in the melanoma, what you would see, if you see the picture, the changes in color, different shades of color you will have. Different changes in color, different shades in color, and you have lesion on the shoulder, lesion behind the ear, same approach. It has been there for 10 years. You have come in today because it is increasing in the size. Sometimes it is itchy. It itches and it has tingling sensation. So I told you tingling sensation. Sometimes they give you tingling sensation as well. The color is irregular. Margins are irregular. That's why you need to ask about the change. When you ask about the change, you will able to get the change. It bleeds on touch. It has been increasing in size in the last 6 months. She is normally fit and well. No family history of skin cancer. Work as a gardener. You like sunbathing. Okay. So this is how you will do. So that are the different types of melanoma. Okay. But these are not melanoma. These are the acne. This is another. What do you think, doctors? What it is? Write in the chat box.
Impetigo.
Impetigo. Okay. What it is?
Chicken pox.
Okay, it could be chicken pox. Okay, so just pictures. 50-year-old man made an appointment to see you. You have a red lesion on your arm for past 1 month. It appeared gradually and it is progressing. It is reddish in color. It's round in shape. It is itchy. Your wife is 38 weeks pregnant and you are worried that your wife would get that same lesion. You not traveled abroad recently. What it is? What do you think? What it? Sorry? It's a very important scenario. You had a red lesion on your arm and it can be sometime on the head as well. It is rounded and